this is why we really suggest to the people that are at risk to benefit from the vaccine to not to get hospitalized, as Dr. Quach said, and this is the purpose of all of this.
With fall now here and respiratory virus season upon us and COVID cases on the rise, the Quebec government is moving ahead with its vaccination campaign. The province's public health director, Dr. Luc Boileau, saying that starting October 2nd, residents of CHSLDs and private seniors' homes will have access to COVID vaccines and flu shots. For the general public, it begins on October 10th.
We do not expect the movement for hospitalization to be at a level that will be seen as something that what we have already seen a couple of years before. So we're quite confident that there will be an increase, but not that much. And if you observe at the intensive care units, we have less than 30 patients right now in Quebec with the, I would say, the contamination rate that is mostly like what it was last winter. So it's quite heavy right now, but still we don't have that much of hospitalization, and in particular of intensive care units.
Around 670,000 Quebecers infected with the respiratory virus during the week of September 17th to 23rd, according to the National Institute of Public Health of Quebec. COVID-19, influenza, and RSV are what is circulating most among the population right now. The wave of COVID-19 is particularly strong, already approaching the spread observed last winter. The government urging those who are most vulnerable not to wait to get vaccinated.
The people for whom the recommendation was made was for people with underlying medical condition or those that are at risk of complications and hospitalizations. That means those 60 years and over, those with underlying medical conditions that, they should know that they're at risk or discuss it with their pharmacist or their physician, and those with immunosuppression. I understand that people might be tired about getting a vaccine, but it's really similar to influenza. So we start a new season, we have new viruses circulating, there's a vaccine that has been updated for what's going around. I think now is the time to get it, because the last thing we want is for those people to end up being admitted.
The National Advisory Committee on Immunization recommends that people get a new COVID vaccine dose 6 months after the last one or an infection. And the government's reminding people to show common courtesy.
What we really want for everyone in terms of limiting transmission is respiratory etiquette, which means regardless of the virus that you have, if you have fever, a runny nose, cough, whatever, you try to stay away from others. If you have to go out, you wear a mask. What Dr. Boileau was saying, cough in your elbow, throw out your tissues rapidly and then wash your hands after manipulating your respiratory secretions is what is going to be most helpful.
In Montreal, Sudarasi, City News.